Good afternoon, everyone. I'm Dr. Sagar. I'm working under Dr. Jayashree ma'am. First of all, I'm thankful to ma'am for giving me this opportunity. So, as ma'am had already discussed that ki breast cancer, what exactly and why the awareness is important. Showing the photograph of Angelina Jolie is because in 2003 she had undergone a prophylactic mastectomy because she had diagnosed with the BRCA gene, which is one of genetic marker for CA breast. She also had a history of cancer in her family. Her mother was suffering from cancer. Prophylactic mastectomy was only possible because she was aware of what all things and what all indicators are there for prognosis for cancer. Main motto of showing the photograph is just because to know, and she is aware, so she underwent, so the chances of and the prognosis has been improved now because the chances of prognosis will be better if you diagnose early. As she diagnosed as a BRCA gene 1 positive, so she underwent a prophylactic mastectomy in 2003. So now the chances of further, health improvement are improved now as compared to previously. Just because of the small awareness of just the knowledge she had faced, and she has passed the consequences which can happen if she is not able to diagnose things. So other factors I will be discussing, and some other factors will be discussed by ma'am, and also what are the chemotherapeutic and radiotherapeutic managements, and what are the side effects of that will be discussed by ma'am. If you see the graph here till 2018, the number, if you compare the numbers, the maximum number will be seen is 14% is the breast cancer. So number of breast cancer is increasing is if we see the overall cancer rate. What are the facts? Why the breast cancer is increasing? If we see the facts, then there will be a lifestyle changes, lack of awareness, absence of breast cancer screening program, cancer not a priority issue, clinical advances not reaching vast majority. So lifestyle changes is just because the number of working hours, working hours previously 10 years back, the working hours for the woman, and now it's been changed. Secondly, the food habits. The food habits has been changed. So, thirdly, the lack of exercise or increase in the obesity. These are one of the factors which are leading to number of cancer cases are increasing nowadays. Lack of awareness is that what I told just now, because that she was knowing that there is a genetic factor is also one of the responsible factor for a breast cancer. So this awareness is still not there. That's why the main motto of keeping breast cancer awareness camp is we should know what are the facts and what are the indicators for cancer for breast cancer. And second thing, the second most common cancer is the breast cancer. Secondly, clinical advances not reaching vast majority. Like there still India is a developing country. If you compare with the US or any developed country, so India is still developing. So whatever the clinical advances is happening, it is not reaching to a vast majority of people. So second most common cancer is in women as the breast cancer. If you compare USA, the number of cases 72 cases per lakh. In Mumbai, 20 cases per lakh. Mortality rate, if you see, 27 per lakh per year. In USA, 1.86 lakh new cases discovered per year. Why we are comparing with USA? Just because USA is developed country. The number of cases and number of cases of India, if we compare, are way different. US is developed nation, India is a developing nation, and there is a lack of breast awareness due to two factors. One is clinical advances not reaching the vast majority, and cost constraint. The cost, basically, if we see the number of cases increased in a higher socioeconomic class as compared to lower socioeconomic class. But if we see in the breast cancer cases, they are equal number. in lower socioeconomic class, because of they don't have a that much of money. They don't have that so because of less money, they can't go for the the, whatever the clinical advances are there, like mammography. The cost is more, so they are not able to afford that. So, because one of these are some of the factors. That's why the breast cancer screenings are there, but still patients are coming. So still patients are not aware of all this stuff. So if we see the etiology, not all the lump in the breast are cancerous. There are some benign lesions which are common in the some age group. If we see between 12 to 40 years of age, there are some lesions which are benign and they are not malignant. Malignant means they are not malignant means they are cancerous, but some of the lesions are not cancerous also. But we have to follow up with our consultants. So fibroadenoma, if we see the examples are some of the examples like fibroadenoma, fibrocystic disease, abscess and infections. These are some of the benign lesions which are common in the breast. They are not malignant, they are not cancerous. If but we have to we have to aware of what lesions are there, so that we have to so we have to go and meet our physicians. Malignant lesions mostly seen in the above 45 years of age. And if we have a family history is important in breast cancer and some of other cancers also. But in breast cancer specifically, if mother or sister or daughter, the history we have to see. If the mother is having, then the daughter, there are chances of having CA in her future of future endeavor. Late pregnancy, gender, mostly female and male both can have a CA breast, but chances of female having a CA breast are more. Early menarche, late menopause, that means the menses, the number of days spent with the estrogen and progesterone levels fluctuating are basically showing these things. So these are some of the etiological factors for benign and malignant lesion. So remember, there are lesions which are benign also, they are not malignant, but we have to show to our physician. So this is basically awareness. Some in India, the chances of cancers are increasing because females are not aware, which they are ignoring the lump, and then after some times or within a 2 or 3 months, it is landing into a malignant lesions. So if early we go, the chances of prognosis will be better. Early we show, the chances of surgery are more. Early we show, the chances of prognosis is better. Risk factor, as I told you, first degree relative with bilateral breast or ovarian cancers, first degree relative with breast cancer less than 40 years of, or first degree male CA breast, first degree or second degree relative with breast cancer less than 60 years of age, first or second degree relative with breast or ovarian cancers. So risk factor, what I am saying is in this slide is, if the relative or first degree relative is having a breast or ovarian cancer, then the in the relatives, there are chances of CA breast or there are chances of cancers are there related to, if the past history or a family history is having ovarian cancer or CA breast. So we have to see the risk factors. We have to know what are the risk factors in CA breast. As I told you, unilateral or bilateral, there are chances that both bilateral CA breast will be there. But if we see the percentage, 4 to 10% chances are there. Lifestyle changes consist of obesity and high fat diet. These are one of the factors of CA. History of radiation and past, history of oral contraceptive pills, urbanization and higher socioeconomic status, certain close communities like Parsis in India. These are also some of the etiological factors having CA breast. Is there any history of hysterectomy? History of hormonal replacement therapy? History of hormonal replacement therapy, that means some of the females are having PCOD or polycystic ovarian disease. So she's taking some hormonal medications. History of previous biopsy. Previous biopsy, the meaning is if you had a lump which is a benign lesion or which is a suspicious lesion, you have shown to a physician, they told you the investigations. If you have done a biopsy or a needle biopsy, these are some of the causes. Greater the age at detection, greater the chances of malignancy. If we see the age, more than 45 years of age, if the female is and having a lump, there are chances that it might be a CA or it may be a CA. For that, we have to do a further investigations. But not all cases having a age of 45 years or 50 years with a lump in the breast are malignant. So just we have to show to our physician to know what exactly. We don't have to ignore if there is any lump. The slides I will show you further. What are the signs and symptoms? So is there any pain or is there any lump in the breast? You just have to meet your consultant or physician just to show when to do breast palpation and breast self examination. The slides will be discussed with by the ma'am. If we see the symptoms, breast complaints will not be there in the breast cancer, and breast pain is will be there in the breast disease. So if the lump is there in the breast, is if it is showing any pain or any symptoms, then it might be a benign disease, but you have to show to your consultant. But a lump which is asymptomatic and which is increased within the 2 months of duration, or 3 months, or within a 10 days, then you have to show to your consultant immediately, because there are chances of malignancy will be more. So if the early you show, the prognosis will be good. The late as you delay the showing to your physician, or ignoring, will land up into a worse prognosis. The prognosis will be depending on the the size of the lump. Fibrocystic disease, these are basically the benign lesions. They are the periodic changes. Infective disease, if the patient or a person is breastfeeding, there are chances that there is development of the breast abscess. They are not malignant. They can be cured with the antibiotic and IND. That is, if there is a pus, we have to remove it. That's it. Fibrocystic disease, these are basically your related to your menstruations. They can be controlled with the medications or just supportive therapy. Symptoms, if we see, there can be a painless lump, discharge from the nipple. Discharge are the various types. Discharge can be red color, black color, or CS color, or yellowish color. Skin excoriation or ulceration, axillary mass, axilla or supraclavicular mass. Late detection in the obese. If the person is obese or weight more, or the BMI if it is more than 30 or 32, there are chances that there is late detection, because it is not palpated or not done properly a breast self examination. It can be chances that it is detected very late just because of obesity. So if we see the signs, if you want to convey to our friend or to our relatives, there are some signs which can be easily seen during your day-to-day activity or day-to-day work. If we see the symmetry of the breast, both the breast should be at the level. The nipple areolar complex should be at the level. If they are not at the level, then they are not in the symmetrical. Then we can call it as breast asymmetry. If we see in the photograph, there are shown the levels of the nipple are not in the line. So if such signs are there, then you can show it to the physician, or you can if some of your relative or a friend is having such things, then they can convey this to the physician concerned. Is there any palpable lump? Lump can be palpable with your hands, or if you are having any lumpish feel in your breast, it can be benign lesion or malignant lesion, but you have to show to your physician. Discharge from the nipple. As I told you, discharge can be red color, discharge can be white color, discharge can be CS. You have to see if there is any discharge. You have to meet your concerned physician. These basically pseudo orange appearance. It is an advanced stage of CA breast. If it will give you a look like the orange peel appearance, the skin of the orange. If we see skin of the orange, it will give an appearance like this. So it might be there, and this mostly it is the signs of malignancy. You have to definitely you have to come and meet your physician. Nipple retraction, nipple inversion. These may be benign also and malignancy also. It can be you have to be you have to undergo some of the investigation to rule out is it a benign or it is a malignant. But one of the signs of malignancy, if we see in the breast cancer, it is a nipple retraction. Skin dimpling, if it is there, then it can be one of the sign of malignancy. Axillary mass, as I told you, axillary mass can be a sign of one of the signs of malignancy.